Lots of you following are parents who have children who've been affected by glue ear, or what we call otitis media with effusion. It's a very common condition that affects fit and well children and blunts their hearing, sometimes for an extended period of time. And whilst we know that if we wait, it will resolve in the vast majority, we do want to be able to recognise and pick up the longer lasting cases and help before the condition has a detrimental impact on education, social life and language development. And so sometimes that involves the use of hearing devices, and sometimes there's a role for surgery in the form of grommet insertion. Now generally we've always used nice national guidelines which suggest considering grommet surgery when glue has persisted in both ears for 3 months or more. But those nice guidelines have now been updated, and the latest update contains some really important adjustments that I think are worth knowing about. And I'd just like to highlight 3 particularly excellent changes. Firstly, the recognition that one-sided hearing loss is still important and sometimes is worthy of surgery. Secondly, the option to consider waiting less than 3 months if it's very clear that a child's hearing difficulties are causing significant day-to-day challenges. And finally, the recognition officially that bone conduction devices can be a great option for these kids. In an ideal world, no child should have to be left with poor hearing for an extended period of time whilst waiting for treatment. And the option of bone conduction devices is something I've expressed for a long period of time. There's also some helpful advice in here on how long to keep kids off swimming and whether antibiotic drops are ever needed. Both very helpful because there's never been really a standard practice for this before. If you want more details on the topic of glue ear and hearing loss, then just scroll further down my page where you'll find some helpful resources.